Did you know that some of the medications you may take daily could have a surprising connection to dementia? As we age, we often rely on medications to manage our health, but certain drugs might pose risks to our cognitive function. Today, we're diving deep into the medications linked to dementia and what you need to know to protect your brain health. Stick around until the end of this video for some powerful secrets to boost your brain health and cognition. Dementia is a broad term that encompasses various cognitive impairments that interfere with daily life. It's characterized by a decline in memory, reasoning, and communication skills, with Alzheimer's disease being the most prevalent form. According to the Alzheimer's Association, Alzheimer's accounts for 60 to 80% of dementia cases, affecting millions globally. The risk factors for dementia include age, genetics, and lifestyle choices, but recent studies have highlighted a crucial point. Certain medications might contribute to cognitive decline. The mechanism behind this involves the effects of these drugs on neurotransmitters and brain function, often leading to memory problems and a decrease in cognitive performance. A study published in The Lancet Neurology emphasizes the importance of evaluating the long-term impacts of medication on brain health, especially in older adults who are typically more vulnerable. Now, let's explore some common medications that have been associated with an increased risk of dementia. Anticholinergics. These medications, including diphenhydramine, Benadryl, and oxybutynin, Ditropan, are used to treat various conditions such as allergies, colds, and overactive bladder. Research published in JAMA Internal Medicine found that prolonged use of anticholinergic drugs increases the risk of dementia by 50%. Anticholinergics work by blocking acetylcholine, a neurotransmitter essential for learning and memory, which can lead to cognitive decline. Benzodiazepines. Frequently prescribed for anxiety and sleep disorders, drugs like diazepam, Valium, and lorazepam, Ativan, are linked to an increased risk of dementia. A significant study in the British Medical Journal indicated that long-term benzodiazepine use can lead to cognitive impairment and may even double the risk of developing dementia. Their sedative effects can impair cognitive function, especially in older adults. Opioids. While they are effective for pain relief, opioids such as morphine and oxycodone have been associated with memory impairment. Research published in the Journal of Pain highlights that chronic opioid use may affect cognitive functions due to their impact on brain receptors involved in memory and attention. Antidepressants. Certain SSRIs, selective serotonin reuptake inhibitors, and tricyclic antidepressants, such as fluoxetine, Prozac, and amitriptyline, can also pose risks. A review in Psychological Medicine discussed how long-term use of these medications might contribute to cognitive decline, especially in older populations, as they can cause side effects that affect cognitive clarity. Antipsychotics. Medications like risperidone and olanzapine, used primarily for mood disorders and schizophrenia, have been associated with accelerated cognitive decline in older adults. A study in the New England Journal of Medicine found that antipsychotic use is linked to increased mortality and greater cognitive decline in elderly patients. Proton pump inhibitors, PPIs. Widely used for treating acid reflux and stomach ulcers, medications like omeprazole and lansoprazole have raised concerns about their long-term impact on brain health. A study in the Journal of the American Medical Association found that prolonged use of PPIs may be associated with a 44% increased risk of dementia. The theory is that these medications can inhibit the absorption of vitamin B12, essential for neurological function. Muscle relaxants. Drugs such as cyclobenzaprine and carisoprodol can have sedative effects that impair cognitive function. Research shows that long-term use of these muscle relaxants can lead to issues with memory and attention, further exacerbating cognitive decline in older adults. Antihistamines. First-generation antihistamines like chlorpheniramine and diphenhydramine are commonly used for allergies and colds. However, their anticholinergic properties can contribute to cognitive decline, as demonstrated in a study published in Alzheimer's and Dementia. Regular use of these medications in older adults is associated with a higher risk of developing dementia. If you or a loved one are taking any of these medications, it's crucial not to stop them abruptly without consulting a healthcare professional. Here are some steps you can take to manage your medication safely. Consult your doctor. Discuss all medications with your healthcare provider, focusing on potential risks versus benefits. They can help you assess the necessity of each medication and explore safer alternatives. Review your medications regularly. Keep a detailed list of all medications you're taking, including over-the-counter drugs. Regular medication reviews with your healthcare provider, especially as you age or experience new symptoms, are crucial for maintaining cognitive health. Consider non-pharmacological alternatives. Lifestyle modifications, such as cognitive behavioral therapy for anxiety, physical activity, mindfulness practices, and proper nutrition, can often help manage symptoms without the need for medications. Stay informed. Research the medications you're prescribed and stay updated on the latest findings regarding their effects on cognitive health. Being proactive in your healthcare can help you make informed decisions about your treatment options. As we wrap up, it's crucial to remember that while some medications carry risks for brain health, it's essential to weigh these against the benefits. Always consult with your healthcare provider about any concerns you may have regarding your prescriptions. Now, before we go, let's talk about how you can boost your brain health. Regular physical activity, a balanced diet rich in omega-3 fatty acids, and engaging in mentally stimulating activities can all contribute to better cognitive function. Consider adding foods like fatty fish, nuts, and berries to your diet, and don't forget to stay socially active as well. Thank you for watching, and don't forget to subscribe for more insights into health and wellness.